Hi everyone, we are going to talk about urinary pathologies and disorders. Now, we talked about them in detail in your assignments for the class. So right now we're just going to focus on massage implications. All right, one thing to keep in mind that the kidneys are homeostatic organs. That means they help maintain homeostasis within the body through regulation of waste elimination, chemical composition, pH of blood, blood pressure, blood volume, fluid balance. They do a lot. All right. Also, keep in mind when you hear the term nephron, nephritis, we talk about nephrologists. Those are the doctors that study kidneys. The nephron is the functional unit of the kidney. And when we use that term, we are talking about the kidneys in general. Now, let's dive into the pathologies and disorders of the kidney with glomerulonephritis. I have to say this one slowly every single time. This is inflammation. If it's acute, it's usually abrupt and it resolves without significant loss of kidney function. This is usually because of inflammation or infection. If it's chronic, then you get progressive destruction in the kidney, leading to irreversible kidney damage and possibly chronic kidney failure. Now, if it's an acute situation, probably due to infection, it's going to be postponed. All massage is postponed, totally contraindicated until the condition has resolved. If it's chronic, the massage is postponed if the client has a fever. Now, they may have frailty in here. They may feel pain in this area. So massage more slowly using lighter pressure. Kidney cancers, like the other cancers we have discussed, ask about current signs and symptoms as well as side effects of cancer treatments. Now, kidney stones are a different thing entirely. While you don't technically have an infection and you're not contagious, if it's in the acute phase, it's potentially extremely painful, and massage should be postponed. Massage can begin when the stone passes or is addressed by medical procedures, something like the client getting a temporary stent put in so that they can pass urine properly and there's no kidney inflammation, from urine retention inside of the kidney. Now, if they have a kidney infection, pyelonephritis, all right, this is a type of UTI in one or both of the kidneys, all right. Now, we're going to talk about the costovertebral angle, the CVA. This is the acute angle on either side of the back between the 12th rib and the vertebral column. This is the area where the kidneys are most easily pushed and palpated. This is the area that typically causes pain in clients with kidney pathologies. Although I would also argue I would avoid the flank, both anterior and posterior, in this area, not just the CVA. Now, with kidney infection, if it's acute, massage is postponed until the condition resolves. If it's chronic, avoid massage over CVA if pressure produces any type of pain. Polycystic kidney disease. This is when your kidneys become riddled with multiple cysts. A point to remember for the MBLEX is this is not bacterial or viral. This is actually an inherited disorder. The involvement is usually bilateral. Bilateral means both sides. So both kidneys are usually affected. And you just need to avoid massage over the CVA if any pressure produces pain. Otherwise, you can massage them normally. Kidney failure, also called renal failure, sometimes can be acute, can also be chronic with a gradual onset. We call it renal insufficiency if they have only 25% of kidney function, and we call it end-stage renal disease or ESRD when there's 10% of less of kidney function. If it's an acute case, we're going to assume it's because of infection and massage is absolutely postponed. If it's chronic, massage them more slowly and using lighter pressure. All right, dialysis. This is when we filter waste from the blood utilizing a dialysis machine. All right. There are access sites to remove and return the blood. We might have an arteriovenous fistula. This is usually placed in the forearm, or we have a central venous catheter that can be in the neck, or in the groin, depending on where they have put it. These patients usually are on anticoagulants used to prevent clotting. Now, what do we do if someone is on anticoagulants? No deep pressure, no deep effleurage, no trigger point therapy. We use a lighter effleurage techniques, and we're very, very careful over bony prominences. All right. Now, when they are on dialysis, if they are on hemodialysis with that fistula in their forearm, you're going to avoid the arm entirely with the fistula. You do not want to increase any type of cardiovascular circulatory pressure in that area whatsoever. You do not want to cause any leakage, bleeding, any type of damage to that fistula. If they are on peritoneal dialysis, you're going to avoid the catheter area, whether that's in the neck or in the groin. If the access area shows signs and symptoms of local infection, this is, of course, swelling, heat, redness, and pain, refer the client to the healthcare practitioner, the HCP, or the PCP, which is the primary care physician, or in this case, most likely the nephrologist, all right, which is going to be the kidney doctor. While prone, place a pillow above or below the catheter. They do recommend using a soft crescent-shaped faced rest cushion can be used as catheter support to kind of keep that area untouched, sort of like a little hemorrhoid donut if you want, to keep it protected so they're not laying directly on that catheter. But you can massage them. You need to discuss the timing of the sessions, though, because it absolutely depends on how this client feels during, after, or a couple of days after dialysis. All right, let's talk about pathologies and disorders of the lower urinary tract. We have UTIs, which are infection or inflammation of one or more structures of the urinary tract. You have urethritis, which is an infection or inflammation of the urethra, and cystitis. This one is important to remember. I've seen students confuse cystitis with thinking about inflamed cyst because we have the word cyst and we have itis in there, but this is an infection or inflammation of the urinary bladder. Cystitis is the infection or inflammation of the urinary bladder. Now, cystitis can be bacterial, usually from E. coli coming from the back to the front, or it can be interstitial, chemotherapy induced, or radiation induced. If they have a UTI, you postpone it if they have a fever. It's otherwise non-contagious, non-infectious. You can absolutely massage them as long as they're not in a lot of pain. Make sure that they don't have any symptoms of sepsis whatsoever, because UTIs can turn septic if not being given the proper antibiotic or taken care of properly. But absolutely, as with everything else, if they have a fever, the answer is no for 24 hours. 24 hours of not taking fever-reducing medication. I will say this in every lecture. If they are popping acetaminophen to artificially lower their temperature of their body, that does not count as not having a fever, all right? That is artificially reduced. You need to wait for a real 24 hours that is fever-free. Bladder cancer, we're going to treat like the other cancers we've discussed. We're going to ask about current signs and symptoms, as well as side effects of the cancer treatments to make sure that we are treating them well. There's also urinary incontinence. We have talked about leakage before in this class. This is a loss of bladder control and involuntary leakage of urine. This can come from stress, from increased intra-abdominal pressure or weak pelvic floor muscles. You could have an urge to go, which is frequent, sudden, strong urges with little or no chance to postpone urination. Mixed, both stress and urge, urinary incontinence, or overflow. This is the inability to completely empty the bladder, causing retained urine to leak or dribble out slowly. All right. Avoid abdominopelvic region if the pressure causes pain or discomfort with these clients. Putting too much pressure on that bladder might cause a little bit of leakage on the table. Suggest voiding, which means urinating before massage begins as a comfort measure. Be prepared for a toilet break during the session. And of course, we discussed this in detail when we talked about the urinary system, to maybe invest in a waterproof pad for your table. Make sure they know the way to the bathroom, that it's easy to access, and that they are able to get to it as often as they need to, as well as our discussion questions about cleaning and taking care of any adult diapers that might be left in the massage office. Anecdotal stories are always fun. All right, that's all I have for you. I will see you in the next session.